about some LED therapy. That's light emitting diode therapies. So light emitting diode is visible light. So it is on the visible spectrum of light. And so there's typically many different lights, many different colors of lights. What we're going to talk about today is green light. So green light at specific nanometers between 520 and 570 resonates with a few very specific things within your skin. It resonates with hyperpigmentation, so we can help to scatter that color so that it's not as noticeable, and also will help control your oils, and will help if you have cystic acne. It will help control that bacteria to help heal that acne a lot faster, okay? So the green light, it's not going to bleach out your color. Nothing's going to bleach out. We're not going to get rid of color. What we're going to do is the color gets absorbed by your melanosomes, by your melanocytes, which are the cells that produce color, and it scatters that color on the surface of your skin so that it's less noticeable. So what we're going to do here is we're going to discuss green. We're going to show you the green light. So this is our new technology, and under this light you just need to stay for 5 minutes and you'll get 6,000 joules of energy within this light. With our old technology, you would get less than that and you'd have to stay under it for 30 minutes. This is a much faster treatment. This whole treatment we're allowing 15 minutes. You're really in and out. We recommend doing it twice a week for a month, and then we can talk about doing maybe a monthly maintenance or something. And then there are things, if you really want to reduce your hyperpigmentation, you need to understand how hyperpigmentation comes about and how to reduce the production of the hyperpigmentation. So in all of our skins, within 1,500 what's called melanocytes, which are your cells that produce color, with 1 millimeter of your skin. I mean, it sounds crazy, but you've got 1,500 of them per millimeter of your skin. So this is what your melanocyte looks like. Kind of think about it in the palm of your hand. And the color is produced in here. And what happens when the color is produced, the sunlight damages this cell, and it makes an enzyme called tyranase work. Once tyranase gets activated, it starts to produce color. The color goes down these dendrites, and it keeps going down until it hits the surface of your skin, and that's when you see the visible color. So the light helps to reduce what you see visibly, helps to scatter that. But then the other thing we want to do, we want to use a good sunblock with titanium dioxide and zinc oxide in it, so that way it blocks any more sun damage from happening, any more UV rays from getting into this cell. And then you also want to do a tyranase inhibitor product, which is, for us, that's our Enlighten Serum. So you want something with arbutin in it, with azelaic acid, with kojic acid in it. You want these things that help so that this tyranase here does not get activated. When it's not activated, it's not going to produce any more color. So we want to scatter the surface, we want to protect the surface, and we want to protect your cell from producing this enzyme that produces the color. So I hope that makes a little bit of sense. I want you to understand how it comes about so we can understand how we can reduce it, okay? So Christy's going to be under this light for 5 minutes, and in other videos we'll show you different colors of light. We have a red light, we have blue light, we have a lot of new things going on that we're going to share with you shortly, okay? Thank you. Aloha.